Upper eye lifts, or blepharoplasty, are now one of the most popular cosmetic surgeries in the UK. But while demand rises, so does the number of unlicensed people offering surgery for cash. We went undercover to investigate. We found one woman, Luyen Vu, offering a whole range of under-the-knife cosmetic procedures, including facelifts and blepharoplasty. Posing as a client, it took minutes to book, no medical history asked for, no formal consultation, just a few messages and we were in.
I'm a bit worried about what's come across my desk, like what I've been made aware of. I'm seeing that people are going to or getting backdoor eye surgery done. I never thought I'd see the day, but it's happening. I've seen that there's an individual that's carrying out eyelid surgery in a non-sterile environment.
I do have regrets. You're absolutely right. If I could do over again, I probably would still do the upper blepharoplasties, but I would not do the lower. I am certainly regretting having my blepharoplasty done, at least the revision. July of 2022, I had an upper and lower blepharoplasty done by an oculoplastic surgeon in Florida. I'm really happy with the upper blepharoplasty. My upper eyelids were hooded and I was getting a little bit of ptosis, which means like the eyelid was kind of pulling down a lot. And so I really wanted to have it done before I had any problems and just for cosmetic purposes. While I was there, I was always very insecure about my under eyes. I have very hollow under eyes and a lot of crepey skin. There's not a lot to do because I can't put filler there because I have pretty severe allergies and it's really not a good idea to put filler there anyway. It was just truly an insecurity. Did I have to have it done? Nope. A few months after my blepharoplasties back in July of 2022, I realized that this eye was developing what's called an ectropion and it just wasn't closing properly. I have a whole bunch of videos talking about all the details about how I found out and why I have severe dry eye just in this eye. Fast forward to this past February of 2025, 2.5 years later, I went back to the original surgeon. At the time, I didn't think he did anything wrong. I know that it could be just a risk that you take, that sometimes you can get ectropion. So I honestly didn't think that he did anything wrong. Again, remember, this is an oculoplastic surgeon, a plastic surgeon essentially who specializes in the eyes. So I just felt confident that maybe this was the way my eye healed, which I did read online about, and he also told me that. There were a lot of red flags. My bad. I should never have gone to him. But I am deeply regretting doing the lower blepharoplasties, even back from July of 2022, because the creping never went away. I'll be honest with you, the recovery was painful and it really didn't make a difference at all in terms of how it looked. My eye seems to be getting worse. It is so severely dry all the time and so painful. I do regret the person I chose because I think he's terrible. This is what it looks like. My eye is a little bit less blurry today, I think, but it's so hard to tell and it's still pretty painful, which I did not experience this pain with my initial blepharoplasties. I had an upper and lower blepharoplasty in July of 2022, and after a couple of months after everything healed, I realized my right eye was constantly in pain. I couldn't sleep at night. I had to keep putting this petroleum-based ointment in my eye to keep it from drying, otherwise I would be up all night long with excruciating pain. And every time I saw my surgeon, who was an oculoplastic surgeon, by the way, who specializes in eyes, kept saying it's going to take a few months to heal. So I went back at 6 months, still same issue, no difference. And he said, well, give it the full year. Gave it a full year, still no better. So this entire time, every night, I have to put in this petroleum-based ointment. Otherwise, I can't sleep at night. I have severe eye pain because of dry eye. My eye wouldn't close and stay closed all the way on this side. It was a little bit, well, a lot annoyed with me that I kept going back, and I was like, I just want this fixed. Like, I didn't have this issue before I had the blepharoplasty, and I would just like it fixed if there's a solution. So he kept saying to me, I don't know if this will actually solve the problem. So finally, I waited another year or so, and a couple months ago, I went to him and said, listen, it has been 2.5 years, and I cannot take this anymore. What do you think? And he said, well, it's an easy fix. This time he said, it's an easy fix and I just need to pull it up a little bit and you should be fine and have no issues. It's a quick procedure, local anesthesia, you'll be fine. I should have questioned a little bit more, but I was like, okay, finally I get relief from this. And just a reminder, when I had my initial upper and lower blepharoplasties, I opted for general anesthesia, so I was not awake during it because I'm pretty tough with a lot of things, but eyes and teeth I'm not okay with. So I want to be put out whenever possible. And this was going to be an extensive procedure, of course, to do the uppers and lowers, both sides. So fast forward to when I had my revision done, he said, we'll just do quick local anesthetic, it'll be fine. Another day, I will tell you about the barbaric, and I mean barbaric experience I had when he did this revision. But right now, I'll just focus on the healing. So this is what it looks like. That has been my journey so far. The blepharoplasties, people talk about them all the time and how you don't have any issues with them. And for the most part, I think people do really well with them. They do make a huge difference in your appearance. But please know that you can have complications and be stuck like this.
Your eye cannot fully close. Every single night, for months, maybe years, you lie in bed, put thick ointment on your eyeball just to survive till morning, and pray the pain doesn't wake you up at 3 a.m. This is not a rare side effect. This is what some people are living with right now. After a surgery that was supposed to make them look better, it's called eyelid surgery or blepharoplasty. And right now, it is one of the most requested cosmetic procedures on the planet. Clinics call it simple. Influencers call it a quick fix with barely any downtime. But behind the smooth, camera-ready results, there is a version of this surgery that nobody puts in the before and after post. Today, we are talking about that version, the complications, the risks, and the questions you need to ask before you ever let anyone near your eyes with a scalpel. Let's start with what this surgery actually is, because most people only know the marketing version. Blepharoplasty is a procedure done on the eyelids. It can be done on the upper eyelid, the lower lid, or both at once. During the surgery, a doctor removes or repositions fat, skin, and sometimes muscle around the eye area. People get this done for two different reasons. Some genuinely need it. The eyelid skin has drooped so low that it's actually blocking their vision, and the surgery is medically necessary. Others want it purely for cosmetic reasons, to change how their eyes look, with no medical need behind it at all. This distinction matters more than most people realize. If your vision is actually affected, the risk of surgery might be worth taking. If you just want a different eye shape because of a trend, the calculation should look completely different. Let's watch a few more clips.
I got up last night and walked towards the bathroom, and I was like, something is not right. And I couldn't see out of my right eye. This is now 1 week post-op. This is blood. Today makes 1 week. Last night I went to the bathroom. I noticed I could not see out of my right eye. I turned on the light and I was pouring blood out of this right eye, like pouring blood. I still am like wiping blood. And I freaked out. I gave myself a panic attack because of course I chat GPT'd like what could possibly be causing this 1 week after surgery. I don't remember like causing any like harm to my eye. I didn't push on anything. I haven't touched the area. So I ended up calling the surgeon in the middle of the night. And he said it was most likely a blood vessel, near the incision that just in its healing burst. But it scared me so bad. Looking at my eye, you can still see it's like a tint of red. Just because it's like the blood is in the tears and I'm still using ointment. So definitely scared me. He did say that it wasn't common this far into my recovery. So I do have my post-op tomorrow. It's almost 3 hours away. So it wasn't like I was going to go today. I mean, of course, unless it continued, but it has eased up. So I have my appointment tomorrow to see. While I was on the phone with him, he called again this morning. So while I was talking to him, I did ask, like, I noticed like this eye is definitely more like flush. It looks actually more concave in this video, but it truly, in person, it feels less like concave than just a normal crease. And then this eye is definitely more puffy, and this is the eye that gave me such a scare last night. So yeah, I don't know. I'm just hoping everything is okay and it's healing. and it doesn't cause any long-term like scarring or, I don't know. Of course, it's my eye with the corneal erosion that already scares me. But I lost track of my thoughts when I was talking about when I went to ChatGPT. It scared me so bad because it was like, get to the emergency room right now. Like, you could lose your vision. So that's why I quickly called the surgeon's office. I'm typically not one to like call or bother doctors in the middle of the night, but I was like, no way. I spent $6,000 on this surgery, and they can answer their phone in the middle of the night if I need them. So that's where we're at. Tomorrow is my post-op, about 3 hours away. I'll hop on here and answer any questions you guys have. The physician said while I was on the phone with him, I said, this eye looks a bit concave in comparison to this eye. And he said, well, don't worry, I remove fat from both sides, so it's probably just the healing. So I was happy to hear him say that, because I have been concerned that this eye is more flush and this eye still feels like it has the bag. That is the eye with like the broken blood vessels, so maybe that had something to do with the puffiness too.
And the truth is, every time a woman gets an unnecessary upper bleph procedure, a little bit of Gisele Bündchen's essence in our society dies. And when I say unnecessary, I mean like 90% of people who are getting upper bleph procedures. This is like a completely made up beauty standard that has no reason existing. We could go into how most beauty standards have no reason existing, but this one specifically, who is even, why is anyone actually falling for this? Have you guys seen Gisele Bündchen? Have you guys seen Jennifer Lawrence? Those things made them so unique and so beautiful. I won't say that like no one ever needs an upper bleph, but I'm saying that if you were like 25, why would you do that to your face? And the recovery period is way longer than anyone is telling you, because most of the time I can see that bleph is still not healed. And when it does, it kind of makes your eyes a little stiff. No one wants to tell you this. Women, your upper eyes are beautiful. You have your anatomy there for a reason. Please do not get your upper bleph done. In 10 to 20 years, we're going to look back and be like, literally, why did that exist? There's no reason for that beauty standard to exist. It's like when people were complaining about like this part of their arm. Who actually cares? No one actually cares. Please do not get your upper bleph done. I'm not saying that makes you ugly, because it doesn't, but I'm saying that it's unnecessary, especially with the given risk.
I feel like I've always been a supporter of plastic surgery in way of like making yourself feel better and doing things that like are good for you. But then I just saw Brooke Schofield's TikTok where she got her eyelids cut. There's gotta be a limit. Like, some lips look like they're gonna explode. Like, everyone, like, you girls are beautiful. It kills me. Oh my gosh, Brie Olsen, before all the plastic surgery, beautiful. Now, I'm scared.
I need to cover up these black eyes from the complications that are going on with my bleph. Get a little deeper into what's going on. I have these black eyes because I'm getting injections that are breaking up the scar tissue that is attaching to my orbital bone down here and pulling my eyelids down. The injections are deep. They are basically into my bone. They are the most painful thing I have ever done in my entire life, and I have given birth twice with an epidural, but still. But I'm actually feeling so much better since my crash out. The injections feel like they're working. I have the most movement that I've had in a long time. I went in to do this initially because I had darkness and hollowness under my eye. So what we did was we added fat from my stomach to my under eye, and we did a bleph to smooth everything out. That's how it was explained to me. Obviously the black eyes are driving me crazy because darkness was one of the reasons I went in the first place. But to clarify, I made that video because I wanted people to consider how dangerous and how much of a big deal plastic surgery is, when I think it's very normalized as like everyone does it and it's really easy. differences. That makes me me. We are all starting to get to a place where we're all trying to look the same, and it's a little black mirror, and we really need to stop doing it.
I think what the bad Bradley Cooper eye job has taught us is that no matter how hot you are, no matter how good looking you are and have been all your life, you are just one bad plastic surgery away from having it all gone. The little thing that your plastic surgeon tells you is a flaw that he could fix could be the magic sauce that was making you attractive in the first place. Sometimes we don't really know why we find someone attractive, what makes them attractive. There's a certain magic to what makes someone attractive, and I don't think it can just be broken down into numbers. And that's why relying on a surgeon to tell you what's wrong with your face and that they could fix it, that's a dangerous game. And I think that's probably what a lot of these celebrities are doing. The other takeaway should be, if you've always had hooded eyes, meaning, you got a little like fat pocket or fold over your eyelid. If you've always had hooded eyes and you're generally considered attractive, you are playing with fire if you take that away.
Now here's something that should genuinely worry you. Not everyone performing this surgery is even qualified to do it. Investigations have found people with no real medical license offering eyelid surgery along with other cosmetic procedures for cash with almost no screening process at all. No questions about your medical history, no proper consultation, just a quick message exchange and you're booked in. Some of these procedures have repeatedly been carried out in spaces that were not properly cleaned or sterilized. Stop and think about that for a second. This is surgery happening on your eye, one of the most delicate, sensitive part of your entire body, being performed by someone with no formal training in a room that isn't even safe. That is not a shortcut. That is a serious gamble with your eyesight, and it's happening more than people assume. But here's the part that matters even more, and it's the part that gets ignored the most. Even when this surgery is performed by a fully trained board-certified eye surgeon, someone who specializes specifically in eyelid and eye socket procedures, things can still go seriously wrong. This isn't some rare, 1 in a million outcome. It happens often enough that it needs to be part of the conversation before anyone books a consultation, not after they've already had the surgery. One of the most common complications is called ectropion, and this is when the lower eyelid turns outward, away from the eyeball, instead of sitting flush against it. And it might sound like a small cosmetic issue, but it's actually a functional one. When the eyelid can't fully close, the eye can't stay properly lubricated. This leads to chronic dry eye, which isn't just mild irritation. We are talking about constant burning, stinging pain, difficulty sleeping, and in more serious cases, damage to the surface of the eye itself, called the cornea. Some people end up dealing with this for years after their original surgery, applying thick, greasy ointment to their eye every single night, just to make it through until morning without waking up in pain. Recovery time is another area where people get seriously misled. Eyelid surgery is often marketed as quick, easy, and low downtime. Get it done, take a week of work, and you're back to normal. But the real experience for a lot of patients looks nothing like that. Healing can take months. In some cases, it takes over a year before things fully settle, if they settle at all. Patients are often told to simply wait longer for the swelling or stiffness to resolve, only to check back in 6 months, then a year later, and still be dealing with the same exact issue they started with. Bleeding complications are another risk that almost never gets discussed publicly. Some patients have experienced sudden, unexpected bleeding from the eye area, even a full week or more after their surgery, seemingly out of nowhere, with no clear cause. And this kind of delayed bleeding is not considered a normal part of healing. And when it happens, it can be absolutely terrifying, especially if you don't understand what's causing it or whether it's dangerous. And then there's the issue of uneven results. It is entirely possible to come out of this surgery with one eye looking noticeably different from the other, one side more sunken in, the other more swollen or puffy. Surgeons will often explain this away as normal healing, since both sides can heal at slightly different speeds. But if you're the patient looking at the mirror every day, that explanation doesn't make the anxiety go away. It can take a long time before you actually know whether the asymmetry is temporary or something you'll be looking at permanently. And when the first surgery doesn't heal the way it's supposed to, patients are sometimes told that fixing it will be simple, a quick revision they're told, done under local anesthesia, nothing to worry about. But a revision is still a surgery. It still carries its own risks, its own recovery period, and there is never a guarantee it will actually solve the problem. Going from a major procedure done under full general anesthesia, to a second procedure framed as minor and simple is a shift worth questioning, not just accepting. Now let's get into the part of this conversation that actually matters the most, because this goes beyond just the surgery itself. A huge part of why eyelid surgery has exploded in popularity comes down to one very specific, very narrow beauty trend: eyes with zero fat, zero fold, completely smooth from lash line all the way down to the brow bone. But here's the honest truth: that is not how human eyes naturally look. Having a hooded eyelid, a little natural fullness, or a visible crease is not a flaw that needs correcting. It is simply normal human anatomy. And a lot of people are walking into consultations being told that a completely normal feature on their face is a problem, when it was never actually a problem to begin with. It's a manufactured insecurity sold back to you as a fix. And this matters than people give it credit for. So much of what makes someone's faces genuinely unique, memorable, and attractive isn't about matching some perfect, standardized checklist of features. In a lot of cases, the exact features that get flagged as flaws in a consultation room are the very things that give a face its character. Once you surgically remove that feature, there is no simple undo button. Revisions exist, sure, but as we just covered, revisions bring their own risks, their own long recovery, and absolutely no guarantee that you'll end up looking or feeling the way you did before any of this started. So what should you actually walk away with from all of this? It is not that eyelid surgery is inherently bad, or that no one should ever consider it. Plenty of people have real, legitimate medical reasons for needing this procedure and genuinely benefit from having it done. The real takeaway here is about how you approach the decision. Always verify that your surgeon is properly licensed and that they specialize specifically in eyelid and eye surgery, not just cosmetic surgery in general. Ask directly and specifically about possible complications, not just the benefits you see in the photos. Understand clearly that recovery can take far longer than what gets advertised online. And most importantly, take real time to think about whether the thing you want to change is actually a problem at all, or whether it's simply a normal part of your face that a trend or a sales pitch convinced you to see differently. Your eyes are not broken. Before you let anyone convince you otherwise, make sure you know exactly what you're risking and exactly who you're trusting to do it.
My opinion on this is pretty brutal. I think you're just being really callous with your face, because even if someone is an artist and she's not regulated, what does that mean? It means that she doesn't have the qualifications to do this procedure. She probably doesn't have the right insurance if something was to go wrong, to pay for all the damages and the rectifications that would be needed. And also, really, something that people always really forget is when you have the right accreditation to do a treatment, you actually are able to, if you've got the qualifications to do a treatment, you're actually able to get training from the best in the world. And the best in the world aren't going to train you if you don't have the accreditation. So, if you're not on a proper register, like the sort of the nursing register, the dental register, the medical register, and there's a couple of others as well, like the pharmacists and optometrists. But if you're not on these registers, you won't even be able to get on the best courses to get the best training. So even if you think that this person's an artist, there's going to be thousands who are better than her, tens of thousands who are better than her, because she can't get the level of training that they can. So I think people just luck out until they don't, until it goes really wrong, or people die, or they lose their eyesight, and then they're in the news. But why should it take that for us to sort of have a collective conscience to not do this sort of stuff? I don't know. I mean, ultimately, it's not my business.
If you made it this far, I appreciate you watching. Let me know what you think in the comments. If you enjoyed the video, don't forget to leave a like and subscribe for more content like this. Creators' handles are in the description box below. I'll see you in the next one. Bye.